Good morning. Welcome to sunny California. Thank you for joining CCN, Connect Care Network channel. This is Consumers Doctor, Dr. Bengala, a non-profit establishment to educate the public. Today's topic is Medicaid, the health insurance for the people who can't afford health insurance. So the state gives them the Medicaid card. Let me tell you, this Medicaid, I don't know how much federal government gives the money to the states, but that Medicaid money, it's your money. It's your money. I wish they give all that to the consumers in the form, instead of giving the Medicaid card. I know everything about Medicaid. I've been in healthcare. And most of the providers refuse to accept Medicaid. You know why? One time I sent, after seeing about 20 patients, I billed it to Medicaid or Medi-Cal. In California, it's Medi-Cal. They have the gall to send me a check for 1 cent. This is how the Medicaid is. Why would providers take it? They refuse to accept Medi-Cal in California. So what I'm saying is, if the state really wants to help common folks in the lower income category, they're giving these free like EBT cards anyway, and they also give Medicaid cards for health insurance. I wish they invest that money in all of us, especially in a lower income, people who can't afford it. You can't afford the insurance. They're giving food stamps. They're giving EBT cards. That's fine. I think that's what the government job is anyway, to help the poor. But the way they do it, it's just, they spend half of the money on bureaucracy. Half of it, somewhere it disappears in the middle. I wish if they can invest. I'm talking about, this country, we have spent $3.7 trillion 2018. We are talking about $10,000 per person for the entire US population. It comes to 10,000. What I'm saying is, invest. This is for healthcare. Invest some of the money towards healthcare. Give them the $1,000, whatever it is, and incentivize them. If that will reinforce them to be healthy. I'm talking about the lower income people. Right now, they just want to throw the money away, and they get into drugs and you name it. They get into all sorts of misuse. Why can't they invest the money so that empower the consumers so they can go and get a decent, like most of these guys don't have any home. I'm talking about a home policy, home insurance. It doesn't matter. They drive a car, they have to have an auto insurance. The same thing. Health is an asset, folks. Health is a must. You need to have insurance for everybody. You have to have, it's the same thing like if you don't have a home policy or auto insurance, they get penalized. It's the same thing. If you don't have health insurance, like Social Security, you have to have health insurance along with Social Security. What will that do? That empowers the consumers. What will happen is, if a 35-year-old, mid-30s, he lives on the streets, he has no money, he has no home, no family, don't throw money at him. Just give them incentives to stay off the street. Most of them have psychological problems, so facilitate and position them in such a way they can be safe. But have them get a policy, which is you go through the underwriters. Once you have a policy, it is a lifetime policy, healthcare policy. I think the present administration is mandating it's like a house. Once you have a policy, it lasts for a lifetime. As long as you own the house, you have same thing with health insurance. As long as you have your own body, you have to have a policy, you have to have insurance. So what will happen is, if I'm healthy, if my premium is, traditional premium is 400, 500 bucks. If I buy a lower premium, it might be 200 bucks. First year, government can facilitate if they don't have the money of the deductible premium, $1,000, whatever it is, 1,500. Government has to facilitate first year. But once they have the funds, if whatever the money they save for 300, whatever it is, 200-300, they can put it in the personal care health savings. And that goes a long way, year after year, year after year. First year you may have $2,400 or $3,000. Second year you will have $6,000. Third year $18,000. Yeah, I'm talking about for the poor people who don't even have a home to live on, but they have money aside for the health. That's so important. And when people, you give them that entitlement, they will take care of their own health. They will not get into drugs. You will not have obesity. Believe me, your health habits will change. And you eat proper food. You take care of yourself to keep your premiums lower. Is this something am I talking crazy? No, I'm talking about for people who don't have a home to live on. You know, housing and urban development, they're doing a good job in empowering the Americans by investing in the lower income. They're called opportunity zones. Same thing, federal and state can invest. We have about 20 million people who are not working, 20, 30 million who cannot afford insurance. Actually, that's what it is. 160, 170 million blue collar workers, they have a job, they have a private insurance. 70 million on Medicare. You're talking about 240 million. And 60 million are so-called self-employed, 40 to 60 million. So you're talking about 20, 25 million and 10 million probably illegal Americans. Those folks can be helped, but governments have to facilitate that, empower them to climb up the ladder. They don't do that. Even the media doesn't give you a right perspective. Media should help common folks how to climb up there. Media has ever said what this present administration has done in healthcare? There have been a lot of changes in healthcare, especially in last 3 years. There have been a lot of changes. Believe it, a lot of people don't even know what it has been. You know, you're talking about, you know, having insurance to average folks and also empowering them. They get to choose their doctor. They get to choose their plan. And transparency, that's another big thing. Transparency they have done. And right to die, you know, basically right to have a drug. Because if they are sick, terminally ill, they can try experimental drugs without having an FDA. And veteran choice. There's so many things. Media doesn't even talk about it. And they want to do more. But they won't let them because they want to control. That's the thing. This is what the sad part is. This Affordable Care Act, folks, is not really about healthcare. It's about the control. You get it. This is about the control. They want to control you. They don't want to make you free. They don't want to empower you. This Affordable Care Act is not in your favor. I would say, you know, I've been brought up and raised in India. We have 1.4 billion people. You're talking about poverty. This is nothing. Poverty in India, they live day to day. They don't have a welfare. They don't have social security. They don't have unemployment. You know what? They're doing better than America. You know why? They have this, British introduced the tier system where, you know, first class, second class, third. But I don't like that. But at least people get free care for third class citizens. They get care. But nobody wants to go there because they want to be free. You can, if you want to create county access to everybody, average folks, that's fine. But what I'm saying is incentivize, empower them to have a choice. They can make, a lot of people don't want to go to county hospitals. You know that because they're overcrowded. But give them the tools what they need so they can see their own doctor. You know, nowadays with telehealth, you can see your doctor right sitting at home for $20. You know, the healthcare has to go down. The cost has to go down. There's no way we can continue what we are doing in the healthcare. We cannot be spending $3.7 trillion and still rank 37th among the most advanced countries. India is probably doing a better job. They spend 1.5% of GDP. Here we spend 19. It went from 18 to 19. First time we have surpassed the defense budget. It's crazy. And nobody looks at it. And they keep pumping the money into these so-called insurance companies. They're greedy. They don't even want to help the common folks. If they are really serious, you don't have to give them the tools. All the insurance companies have them enforce these lower premium policies instead of traditional policies. Have them. You can have a traditional pricing structure, but have them force it into personal care accounts. This will go a long way. We shouldn't be spending. If we do this, our healthcare budget will go to half. I can bet you. And we'll be number one again. And you'll have a choice. You'll have a choice to go to a facility. You will have a choice to go wherever you want and get the care. And you have a price transparency. If people want to know about price transparency, go get Healthcare Blue Book. It'll give you a cash price. How much is the CT scan or MRI? Cash price. 70% lower. I'm not kidding. There's no billing, folks. Surprise medical billing. This Medicare has destroyed this CPT, DR. These are all made up numbers, folks. These are not right numbers. Consumers have to look at it and they decide what they want to pay. Let the consumers decide how much. I want them to decide how much they want to pay for the heart surgery. This Dr. Deepak Shetty in Cayman Island, he does surgeries on children with holes in their heart for $800 guaranteed. And you know what he does? He has the family members come and take care of these folks. The nursing staff is less. He keeps the cost lower. The family members, they train them to take care of the children post-op, right in the hospital. There are ways to lower the cost. We don't need to come up with, if you want to, we have created Amazons and Googles, Facebooks. Why can't we do something in healthcare? I just don't get it. We need to be smart. Americans are in general smart. They can handle their healthcare better if we give them the right tools. Government has to trust the Americans. Invest in Americans, folks. Invest in, especially people in the bottom. They need help. They really need help. And this is the right way to do it. Don't throw money at them. Give them the right tools. They can empower themselves. Thank you for joining. This is CCN channel. Consumers Doctor, Dr. Bengala is a non-profit. If you like this, keep joining. I'm trying to go. I'm trying to get into streaming, broadcast. So once I get there, I would like to hear the comments. Subscribe to the channel, and we'll see you in the next episode. Again, thank you for joining. God bless you.